The Italian physician Enrique Morselli first described body dysmorphic disorder, or BDD, in 1891 by using a term dysmorphophobia, defined as the fear of having a deformity. Body dysmorphic disorder is a mental health condition in which you can't stop thinking about one or more perceived defects or flaws in your appearance. Now, these flaws appear minor or can't even be seen by other people. However, you may feel so embarrassed and so shamed and anxious that you may avoid many social situations. Patients with body dysmorphic disorder are preoccupied with a perceived physical defect, and this disrupts their lives by causing them considerable social distress as well as occupational dysfunction. When you have body dysmorphic disorder, you intensely focus on your appearance and your body image. You repeatedly check the mirror, groom yourself, or seek reassurance, sometimes for many hours each day. Some people find the idea of seeing themselves in a mirror or any type of reflective surface to be very distressing and avoid mirrors or these reflective surfaces altogether. Otherwise, they only allow a certain part of their body to be reflected. Many people with BDD can face the mirror only under certain specified predictable conditions, for example, in a darkened room and at a certain angle. On the other hand, others with BDD find that they must check themselves in a mirror repeatedly, ostensibly to reassure themselves that their appearance is actually acceptable. However, it mostly has the opposite effect, confirming to themselves how repulsive they are, and it makes them feel even worse about themselves. Many people with body dysmorphic disorder seek out cosmetic procedures to try and fix the flaw. This may bring about some temporary satisfaction or reduction in distress, but often it's the case that anxiety soon returns and people resume searching for other ways to fix this perceived flaw. Body dysmorphic disorder has been postulated to be a symptom of or related to depression. Indeed, major depressive disorder is the most common comorbid disorder in patients with BDD. However, depression and BDD have some notable differences, such as the prominent obsessive preoccupation and repetitive compulsive behavior in patients suffering from body dysmorphic disorder, compared to depressed patients focusing less on their appearance and even going so far as to neglecting completely how they look, rather than becoming overly focused on it. Additionally, body dysmorphic disorder has a approximately equal gender ratio, so men are as likely as women to get it, compared to major depressive disorder, where women are more than twice as likely as men to be diagnosed with it. BDD also has an earlier age of onset and is more often chronic in nature. I found this interesting case study of a 19-year-old male university student who was brought to the hospital after a suicide attempt related to his obsessive preoccupation with his facial appearance. His accompanying family members reported that he believed his face was so ugly that it required a skin graft. 2 years earlier, at the age of 17, he had developed a mild form of acne, and from that time onward he experienced disturbed sleep and became increasingly preoccupied with the appearance of his face. He had repetitive thoughts such as, if I squeeze my pimples today, they'll grow back tomorrow, and I cannot deal with my acne. During the past 18 months prior to his hospitalization, this man increasingly believed that his face had turned ugly and that his skin pores were overly enlarged. He would spend 4 to 6 hours per day checking his facial skin, sometimes washing it 5 to 6 times a day. He told others that if he washes his face often enough, maybe his skin pores would shrink in size. Several times he had scheduled cosmetology consultations to ask plastic surgeons to perform a skin graft, but he was told that there was no reason for the treatment. He continued to believe that his facial pores were grossly enlarged and that others had made fun of him because of this. So that's just one case of a body dysmorphic disorder, and as you can see, it has quite potentially catastrophic outcomes for the person suffering from it. There are also 2 subtypes of body dysmorphic disorder, and that is muscle dysmorphia and body dysmorphic disorder by proxy. So muscle dysmorphia, or MD, is a subtype of body dysmorphic disorder, and it is associated with a number of thoughts and beliefs about oneself and others, including the belief that one's body is not sufficiently muscular and large enough, and generally overvaluing the physical appearance of their body. They also have intrusive negative thoughts about one's body that leads to distractibility and difficulty focusing on attention, and the belief that others negatively evaluate their appearance. Although muscle dysmorphia affects both sexes, several studies have demonstrated that in this particular subset of BDD, males are more affected than females. So sometimes referred to as big orexia or reverse anorexia. Muscle dysmorphia may have some overlap with other eating disorders, but is not exactly an eating disorder. For instance, while individuals with muscle dysmorphia often follow very precise, time-consuming, and painstakingly picky diets, their eating habits are driven by a concern with improving the mass and leanness of their muscles, as opposed to issues relating to their weight or body fat percentage, as seen in individuals with eating disorders. The second subset of body dysmorphic disorder is body dysmorphic disorder by proxy, which is quite interesting. So body dysmorphic disorder by proxy is a variation of BDD in which an individual is overly concerned with perceived imperfections with another person's appearance. BDD by proxy is a significant but relatively understudied variant. Like BDD, individuals with BDD by proxy engage in time-consuming rituals to fix the other person's appearance or to alleviate distress. Now, there wasn't too much find out about BDD by proxy. However, I did find this one interesting case study, which I think is a good exemplar of what it entails. This is a case study of Miss A, who was a 28-year-old woman. Now, after Miss A was married, she was critical of the attributes of her husband and felt that his face was disproportionately big. With the fear that her baby would also share her physical ugliness, she even attempted an abortion, though unsuccessful. Since the birth of her daughter, she indulged in frequent checking and assurance seeking her daughter's assumed deformity of her face. She used to feel guilty for passing along ugliness to her daughter, I guess both from her and her husband's disproportionately large head. This feeling of guilt led to intrusive and troubling thoughts that she would harm her own child, and this led to Miss A avoiding the child completely when she was alone. So that's it for body dysmorphic disorder, as well as the two subsets of muscle dysmorphia and body dysmorphic disorder by proxy. Let me know if you've experienced any of these in your own life. I would be interested to hear about them. And as always, thanks for watching, and remember to drop a like and subscribe to the channel if you haven't.